Welcome back to the Becoming Mama podcast, where two long lost best friends discuss all things motherhood. I am Sam, and I am joined with my long lost best friend, Emmy.
Hello, I'm here.
You're here. We're here. We're doing it. And today we are going to be talking all about oral restrictions. So those are tongue, lip, and cheek ties. And it's something that is very, unfortunately, near and dear to my heart, something that I went through with my son. And I am not a professional. I am not a practitioner. I am none of those things. I am just a mom who did a lot of research because I had to. And I now have a website called freedupmamas.com that has all the information that I ever needed in one place. And so I'm going to be sharing some of that today. I will obviously link that down below so you can reference that as we go for images and if you want more information after the fact. But today I'm going to be talking about everything I wish I would have known about oral restrictions and paint as full of a picture as I can. But before we get into that, we are going to do our wins and losses today. So, Emmy, why don't you kick us off with your win or loss or both of the week?
Sure, I'll just share both. Okay, so my win is that I took the time on Monday. So I think I mentioned in an earlier podcast that I had kind of like the kids and I had come up with this whole list of everything, all of the traditions we wanted to do for Christmas. And so now that we're kind of getting towards like the 12 days of Christmas, the before Christmas one, I was like, how are we going to get all of these activities in? And so Twyla and I ended up finding like a little advent calendar tree where you like move the snowflake and count down to Christmas at Goodwill for $4. We brought that home and I went through on Monday and I laid out all of our activities that we want to do, put them on little pieces of paper, tucked them into the advent calendar so that each day we have one fun activity to do all the way towards Christmas. So that will be really fun. I'm excited
I
about
love
that.
that.
Yeah,
I'm
it should be
totally
cute.
stealing that idea.
Good
We have
plan.
an advent calendar, and yeah, it's so sporadic. I feel like everything I do is like, what should we do now? But that's a wonderful idea.
Yeah, it breaks it down and everything can be super simple. Like it doesn't have to be
Hmm.
complicated. We did like candy canes and hot cocoa. That's going to be one. Like, a Christmas movie. Things we would kind of already do, but just making sure we're actually
Hmm.
checking them off the list type of thing. And
Yeah, I love
then
that.
the loss it's not really a loss. It's more of like an update, but the heart monitor that I'm going to be wearing for a week is actually going to be coming in the mail, so I'm a little bit nervous about wearing that
Oh
and like
man,
how it's going to go and what it's going to say, but um it'll come and we'll find out and see what happens.
we will see. So you cut out for a second for me, but how long do you have to wear it for?
I think I have to wear it for a week, but it could be
Okay.
3 days. I'm not really sure. I don't know a whole lot about it until it actually gets here, so we'll see.
Okay. All right. Good luck. Hopefully it gets some
Thanks.
answers and you won't have any more of those scary episodes again.
Exactly. That's what I'm hoping for too. All right, what about you?
Oh, mine are interconnected. So yesterday, well, actually, I would go with a bigger loss. We talked about this a little bit last week, but we've been having some issues at daycare. I mean, I talked about this off camera last week. We've been having some issues with daycare where I'm just not super stoked with some of the things I'm hearing from the teachers. There's been a lot of turnover, which was not the case when we first started there. It was actually like a kind of diamond in the rough situation where all the teachers had been there for like over 10 years and some up to like 30, 35 years. And now there's starting to be this turnover, and I don't love the environment he's in, but he has friends there. And so we've been trying to navigate that. We went and saw a new daycare yesterday. It's a brand new one. One of my friends works there. They have a lot more flexible hours, so he could go half days, which is something I would love because I don't need him there all day long. But there's not an option to pay for. I'm paying for a full day whether he's there or not at our current one. And they also take parent volunteers for a discount on tuition.
Oh,
And since I would love to be there with him, I would be able to do that. And they found out I used to be a teacher, and their like eyes lit up like, oh, we could say you're certified. I was like, you could.
they're like,
I
do you
don't
want
have
to
a
be the
license anymore,
director?
but yeah. It's like, they're like, we would take you for a full day. And I was like, I'll do a couple mornings maybe, or like a morning. But just the idea that I could go in and volunteer in a care would be fantastic. And that we'd get a tuition benefit. It would literally cut his tuition in half. And that's 4 full days a week. That would cut right now we're paying, for 5 days a week. He only goes 4, but we have to pay for 5. And so it would cut his tuition in half, which is just insane. So that loss and win all in one. Hopefully that works out. But just know that if you have daycare issues, I feel you and I don't envy you. And it's like the hardest, I think it's one of the hardest things had to navigate in motherhood is like, do I want to work or not? How much do I want to work? And I'm so, 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 so grateful to have the options that I've had. But it's still just that guilt and letting someone else take your kid for so many hours a day. And it's such a hard thing to navigate. So
I think
it's been,
childcare can feel like the most epic win on earth if you find like the exact right fit, and it can feel like the
mhm,
absolute lowest of the low to deliver your child each day to a place that you don't really want to take them to feels
mhm.
like gut wrenching. So I feel for those people too.
Yeah,
I've been there, and it's
yeah.
so hard.
It was, and I'm really grateful we have options here. But we will see what happens. Now he keeps asking to go back to the new school, and I'm like, he's gonna say that at school. I know he is. And they're gonna be like, what new school? This one, he's like, I don't want to go to school. I want to go to a new school. I'm like, all right, you say that now, but he is really loved at school by his friends. So we'll see. I don't know. We'll see. But I feel like we're at least in a better place than we were last week, where I was just kind of like, because we talked about it. It was just had me in knots. I just didn't know what to do. So yeah, that
I'm
was
glad
this
you
week.
made that. That's good that you made progress.
We definitely did. So we'll go ahead and jump into oral restrictions. I'm getting my script up here. So it's going to be probably a little longer episode. I will put some images on YouTube. So if you are listening to this on Spotify or Apple Podcasts and you want to jump over to YouTube so you can kind of see what I'm talking about as I go through this, that might be helpful. But like I said, I'll also link the website down below that has a ton of images. It's very well organized, so you can reference that as well. But anything else before we jump into it, Emmy?
Now, I'll just say, like, I have very little knowledge around this topic. I question now that I know, I really don't feel like I know more, but now that I have more exposure to the topic of lip and tongue ties, I am curious if that was a challenge for Fox with all of the pain that we had. We started
Mm-hmm.
breastfeeding when he was an infant. The only other exposure I have is that my mom told my sister and I that we both have, I believe, tongue ties, and they were corrected or whatever when
Mm-hmm.
we got braces. So that's
Mm.
the only really information I have about it. So take it away.
We'll find out. And I did question a little bit when I heard Fox's story. So as I go through get to like the symptoms and stuff, you might be able to tally that list in your head. But that's one thing I will say with oral restrictions is something I look for now because I know the signs and symptoms so much. So the first things I do when I look at a baby is I look at some of the physical features of them. I'm like, you're good. But it's not my place to say unless someone asks me, which multiple people have. I probably helped close to a dozen people at this point now get a diagnosis, find the right providers and things like that. And I'm absolutely here to do that for you. So if you hear these things and you need help, please reach out to us. My contact information is down below, and I can help you navigate that. I will never diagnose or tell you what to do, but I will help you find the people who can help you because that's one of the hardest parts about this. So what oral restrictions are. Oral restrictions are tongue, lip, and cheek ties. And I guess before I jump into this all the way, I do want to say my favorite resources are also linked down below, and this is where a lot of this information comes from. The primary resource being the book called Tongue Tied by Dr. Richard Baxter. He owns the Alabama Tongue Tie Institute and is probably one of the greatest educators on oral restrictions out there, has done a lot of formal research, which is very much needed. And so I would highly recommend that book and that resource down below. So again, oral restrictions are tongue, lip, and cheek ties. And I'm going to break down what each of those are right now. So a tongue tie is a condition where the lingual frenulum, which is the tethered tissue below your tongue. So if you lift your tongue up to the roof of your mouth, you have a little line that ties your tongue to the roof of the floor. And this is a thin band of connective tissue. And when this is short, thick, or in the wrong position, it restricts the movement of the tongue and it affects various oral functions. Lip ties are the same kind of concept. However, it's at the upper lip. So there's a tether that connects the lip to the gums, and everyone has this. But again, if this is short, thick, or positioned too far down into the teeth or the gum line, it causes restriction in the movement of the mouth. And then there's the cheek ties, which are called buccal ties. And this is when that connective tissue, which is in our cheeks, is short and thick and restricts the movement of the mouth, which is why you're seeing this theme of restriction, oral restrictions. Cheek ties are probably the least studied, have what I understand to be the most minimal impact on things like feeding and other issues. So I'm going to pretty much just be exclusively talking about lip and tongue ties here. And I would say tongue ties more than anything, but just know that those do exist and they are something that is being researched more and more. With tongue and lip ties, there are 4 classes of both of these. And these are not based on severity. However, that is one of the biggest misconceptions about tongue tie classes. You'll hear someone say, oh, I had a really severe tongue tie. It was a class 4 tongue tie. When really those classes are based on the position and the thickness of the tie. Classes 1 and 2 are called anterior tongue ties. And these are 2 important terms. Anterior tongue ties are where the tether is forward facing. So anterior means front. So it's where the tip of the tongue, or close to the tip of the tongue, the tether is all the way up there. And so this is probably what you think of when you think of a tongue tie. If you've ever seen a tongue tie, it's where they lift the tongue and you can see this band of tissue that is pulling the tongue back. You also may see a heart shape if a baby sticks out their tongue and the tip of the tongue has a little indent in it. That's because there's a tether that's pulling the tongue back. Can restrict motion. Sometimes it doesn't, but this is what doctors are looking for at the hospital when they check for a tongue tie. It's typically an anterior tongue tie. A lot of doctors don't have the words for this because this is not taught broadly, but it is a very important thing. Classes 3 and 4 are posterior tongue tie, posterior meaning back. And this is where that tether is back further on the tongue. And it's where that connective tissue is more short and thick. It's not long and stretchy. It's not visible. It's very short and thick, but that's pulling the tongue down onto the floor of the mouth and restricts that movement. And posterior tongue ties are very much not recognized by the medical community. More and more, it is getting more recognized, but the words that were told to me when I told my pediatrician that it had been suggested Teddy had a posterior tongue tie, he said, that's not a thing. Verbatim, that's not a thing, which research shows us that it is. So those are really important things to know right off the bat. And the lip tie is as does it wrap around the gum line? Is it up at the top of the lip? And I have images of each of these classes on my website, so you can go check those out. And I'll definitely have those up here as we're talking about it on YouTube. Any questions on that so far?
My only question is, and I don't want to get off on any kind of sidebar, but you're saying pediatrician, doctor. So if you have these concerns and you're a parent and you're wondering, is that your first stop? Is that who you would go to first?
Yes. So we'll talk about this a little bit at the end, but it doesn't have to be your first stop. But the only people who can diagnose a tongue tie, who can say your child has a tongue tie and they need treatment for it, are pediatricians, oral surgeons, dentists, and ENTs. I would say those are not always the people who are best at evaluating for a tongue tie. Those would be more physical therapists, occupational therapists, lactation consultants who specialize in tongue ties, speech language pathologists, and then again, I think pediatric dentists do a relatively good job at this point as well. But typically people who are dealing more with function of the oral cavity in the mouth, they're typically better at identifying tongue ties, and we'll talk about why in a little bit. But unfortunately, they can't diagnose.
But the purpose of going to one of those first professionals that you listed who can give you the official diagnosis is because then they can refer you to a specialist. Is that correct?
Yeah, that would be the case. And for a lot of us, that's the first resource we have, right? You're already going to these appointments, you're already getting checked out. And so at least in our case, that was just the natural thing. It's like we got our suggestion that he might have a tongue tie from a lactation consultant. And then we waited to act on it until we saw our pediatrician. And then we got completely conflicting information, which was very challenging. But yeah, I'll talk about how to navigate that in a little bit, because it's probably the hardest part about all of this. But tongue ties are usually present from birth. There is research suggesting that it's a genetic mutation, but there's also suggestion that too much folic acid may be a contributing factor to this as well. But the exact cause isn't fully understood yet. But it can also just be from like incomplete development of that tissue in fetal development. I think the strongest research we have right now is pointing to that genetic mutation, and tongue ties are genetic. My husband has one. I probably have one. I know my brothers have one. My son has one, and we see that with siblings as well. So now let's talk about that diagnosis piece that you mentioned. So when we talk about diagnosing the tongue tie, there are two pieces that really matter here, and that is the visible, like do we see it? Is it there? Can we feel it? But then it's also that function, because you can have a tongue tie, a posterior tongue tie, and have perfect function. I have a good example of this. A friend of mine had one son who had a posterior tongue tie, horrible feeding issues, had to get a treatment, released, all of those things. But then had a son who also had a posterior tongue tie, was fine, no issues whatsoever. So that function really does matter. And so this diagnosis needs to be done by a trained and trusted professional, and that will always be true. However, getting that diagnosis is often the hardest part, and getting a comprehensive treatment plan is even more challenging because there is no tongue tie professional. There's no tongue tie person you go to. Your back hurts, you go to a chiropractor. You have eye issues, you go to an eye doctor. There's no one who is just a tongue specialist. And so it can be really challenging, and it can be really traumatic for everyone involved. And that was definitely the case for me. And I would say that if you are seeing symptoms and you are having feeding issues, I would truly start with a lactation consultant who says they specialize in tongue ties. I have actually a wonderful resource I will link down below. Her name is Chelsea. She owns a couple of clinics. She can do virtual consultations, and then she can help refer you out to people in your area, which is very much needed. But they're more attuned to this than most pediatricians, because what pediatricians are taught is about anterior tongue ties. They're taught about the traditional tether, and they're taught to just snip it, which we'll talk about in a bit. So they don't have the context, they don't have the information to treat the host of symptoms, and a lot of those host of symptoms are brushed off. However, like we talked about, the only people who can diagnose this are pediatricians, dentists, oral surgeons, or ENTs. A lot of the ties aren't evident to parents. So like when I looked in my son's mouth, I wasn't like, oh, there's a tongue tie there, because it wasn't visible. It wasn't an anterior tongue tie. Same thing with his lip tie. I thought I could see something, and I definitely, now looking back on it, there definitely was a lip tie, but it's not always visible. And so sometimes our biggest red flags are the symptoms. And unfortunately, a lot of modern medicine, the symptoms are treated in isolation. They're not treated as there's a root cause to this symptom. This is something that you're experiencing, like reflux. It's just reflux. And there might be a cause to that. And sometimes oral restrictions are that root cause. And this was the case for us. Like I said, we went when he was born, they said no tongue tie. And I remember being so relieved, because I had people in my life who had experienced it, and I knew they struggled. And then at our 2-week appointment, no tongue tie. 1-month appointment, no tongue tie. And then at his 2-month appointment, after we had talked to professionals that had said, yeah, he probably has oral restrictions, no tongue tie. But my son had a host of symptoms, and so these were my indicator that something was still wrong, and they were just repeatedly brushed off as normal or as colic. So I'm going to go over all of these symptoms right now. It's the most exhaustive list that I feel comfortable sharing, because there are some people who will say like bedwetting could be a sign, and there's just no real correlation yet. So these are ones that I feel comfortable with and that have research behind them. So are you ready for this? All right, here we go. So first off, breastfeeding and bottle feeding challenges for baby are probably the first sign for a lot of parents. So difficulty latching, shaking the head of the breast, difficulty maintaining a latch, so popping on and off, a shallow latch. So one of the biggest things with the tongue tie is that tether keeps the lip tucked under. And so some people even will later in life, if they have a tongue tie, they will have that released and their lip flips out, and it's like they thought they had a small lip their whole life, but really they had just a lip tie. But when they're feeding, they can't wrap around the breast to get that good latch. So that latch is really shallow and it's almost like a bird beak on the nipple. They can have sucking blisters on their lips. So these are often called milk blisters, but really it's because they're using their lip to try to pull the milk because their tongue doesn't work. There's chomping and gumming at the breast because, again, they can't use their tongue the way they're supposed to. A lot of swallowing of air, which we'll talk about in a second. Clicking, seemingly always hungry because they're not getting as much as the feeding as you would expect them to in your 20-30 minute feeding. Falling asleep at the breast quickly because they're working so hard to try to get anything. Long feeds, frequent feeds, colic or excessive fussiness, because imagine being hungry all the time and having the next couple symptoms: gas, reflux, frequent hiccups. Poor weight gain is another big one. And then for body symptoms, they often have the inability to lift the tongue fully. So a lot of times people will say, I don't think my son has a tongue tie, daughter has a tongue tie, because they can stick their tongue out. And a lot of times it's not that outward motion that's the issue. It's the upward motion because the tongue is down, and that's the problem. Body tension, which causes things like torticollis, where the head is tilted to one side or turned to one side. Mouth breathing, because again, that tongue is down on the floor of the mouth, which pulls the jaw down. And so they breathe through the mouth instead of the nose, which can have a whole host of symptoms later on in life. Just an overall tense body. My son was a tight little ball, and with the gas that he had from his tongue tie, they said do bicycle stretches, but we couldn't straighten his legs. It was like this is breaking the knee, putting the knee back. It was so strange. And I just thought that was babies. I thought they just wanted to be a little ball, which now I know babies are supposed to be soft like noodles. Who go figure. A distended tummy because of all that gas they're swallowing. And this is really quite evident when you see a baby's body and the tummy doesn't just go forward, it goes out to the sides. And I have an image of this on my website as well. I'll put this up here on YouTube. It goes, actually, you can see it out from like their back, which is kind of crazy. Stiff neck and shoulder, baby lifting their head early due to tension in the neck. This is one of my biggest pet peeves, is when I see people on the internet whose babies can lift their head early in life and they're like, oh my gosh, they're so strong. And you're like, no, there's tension there. They do not have the strength to do that. It's just, think of a board. If you pick up the end of a board, if you push down on the end of a board, the front of the board's going to come up, right? If you push down on the end of a spaghetti noodle, nothing's going to happen to the end of the board because that's soft. Right? So that tension is what's lifting the head up. A deep set chin. So from the profile, the chin is set back and is like behind the nose and behind the upper lip. Deep red neck creases because of that tension. So they have a lot of rolls around the neck. Sleeping with the mouth open because of that position. Poor oral resting posture, meaning the tongue is on the floor of the mouth, which we'll talk about in a second. Thumbs curled inward or like just tight fists, their toes curled under as well. That's another sign of tension. And then they can also just have chronic discomfort because they are so tense and so tight all the time, difficulty sleeping, and loud sleeping, like grunting and choking noises because they're sleeping with their mouth open, and that tongue can block the airway as well. For moms, you might experience things like a painful latch because of the using of the jaw so much. You might have cracked or bleeding nipples, lipstick-shaped nipples or flattened nipples, again, because of that chomping. And your breast may not fully empty, which could lead to things like clogged ducts or mastitis, and also a dropping of supply because they're not getting what they need. So that is a big one, big, long list. Like I said, there may be more, but that is pretty extensive. And for us, I didn't have any issues. I didn't have any soreness. I didn't have any cracked nipples. I didn't have anything like that. Teddy was gaining weight normally. So all of those symptoms above, he had every single one of those symptoms. And they were brushed off as colic and reflux because he was gaining weight. And so that's where this can be really challenging, because in your gut, this isn't right. But as a first-time mom, you also don't know, is this right? Is this not right? Maybe babies are just stiff as a board. Maybe babies do just truly not sleep. Maybe babies do feed every hour all of the time. And maybe they do fall asleep at the breast every time. But it was that was why he was gaining weight, because he was feeding very frequently. And yeah, it was just pretty crazy. And I talk about this more in the podcast we're releasing next week about our motherhood wins and losses. But yeah, I didn't have any symptoms, but he had every single one. Is that sounding anything like Fox as you hear that list?
A couple of them piqued my curiosity. The cracked and bleeding nipples for sure, and you mentioning being able to lift their head up right away. He could definitely do that almost instantly when he was born. And difficulty latching, that was definitely a struggle for us. And so I guess like my question would be, my intuition was never like something's wrong here. And most of our challenges they completely subsided by about 10 weeks. So do you think it would have been worth getting it looked into? Or do you think it was more of a situation where his mouth was pretty functional? It was just that we were going to have some challenges early on.
I always think it's worth getting it looked into because, as we'll talk about in a second, this is not isolated to just infancy. Some of the things that can occur when due to a tongue tie last beyond just this. Hold on one second. I think my husband's going to make a protein shake. I got to make sure that he's not going to do that. Hey, Tom, are you making a shake? No? Okay. All right, we're doing podcasts.
So would one of the like symptoms you might see later on in life be like liking YouTube too much? Being obsessed with YouTubers? Because if I can release the tongue tie and have that go away, yes, you're going tomorrow.
Yeah. I'll say yes for you. Sure. Maybe. I don't know.
That was just supposed to be a funny little comment. I do think that this is a serious issue, and I would like to know what the long-term consequences of him having that would be.
Yeah, we'll get into that right now, actually. So one of the side effects or symptoms of, I would say this is more a side effect of having a tongue tie, is a high palate. So the palate is the roof of your mouth. And when you are developing as a fetus, your tongue is supposed to rest on the roof of your mouth. And that pressure, your tongue is supposed to rest on the roof of your mouth all the time. So, I mean, right now, sitting there, when you open your mouth, your tongue should be like this all the time. And when that that frenulum is short and thick, it pulls it down to the floor of the mouth. And so that tongue isn't resting there as a fetus, as a newborn, as an infant. And so there's no pressure on the roof of the mouth. And so that creates a high palate. That leads to a lot of swallowing of air. That leads to a different face shape, actually. It leads to chewing and swallowing issues, speech impediments, things like that. And so you'll see a lot of practitioners talking about checking resting tongue posture, because your tongue should always be resting on the roof of your mouth. And if it's not, then we know there might be some tension there in that frenulum. And so if you've ever had a spacer and when you got your braces and something that would widen your palate, you may have had a tongue tie as a child. You probably did. And then the second thing that is a huge side effect of having oral restriction is body tension. I touched on this briefly with torticollis, with some of that tension that Teddy had. But the reason this happens is because that frenulum is connected to the fascia in your body, which is a fibrous tissue that envelops all of our muscles, all of our organs throughout the body. And so when this is tight here in our mouth, it actually tightens up all of the fascia as well. So it adds just this level of tension to our body, and that can have really big, long-lasting implications. Again, this is what causes that jaw to be deep set. This is what causes that tension in the entire body. It's what restricts the movement of the tongue. And so as we move on in life, if that tension isn't released, we can see things like speech delays or issues because the tongue can't move, and your tongue is involved in all of the sounds you make when you are speaking. So a lot of R's and L's and T's and S's that involve the tongue can be really challenging. Difficulty chewing or swallowing. Tongue is very involved in that. Texture issues with food, which I find interesting because my husband hates certain foods for their texture. Hoarding of foods, because swallowing can be an issue because the tongue is really involved in swallowing. So kids will eat a lot of food, chew, 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 and then stuff it in their cheeks. And I find this fascinating because my brother John Steven did this and still does this sometimes. And he definitely has a tongue tie. Apnea, again, you're sleeping with that mouth open, blocking the airway. Open mouth breathing for your whole life, which that's a whole other realm of research that's fascinating, but that changes your whole face shape, jaw, teeth, everything. It's wild. Poor range of motion for your body because you have all that tension, jaw and neck pain, things like TMJ, and frequent headaches are just some of the things you can experience later in life if that restriction is not taken care of. So what do you do? This is the hardest part. What do you do if you're seeing these signs and symptoms? Again, we talked about who you can go see, and who you can get help from. And I'll touch on that a little bit more at the end. But what are the treatment options for a tongue, lip, and cheek tie? The first is to do nothing. If you feel like the function is fine, if you feel like there's no real symptoms, there's no restriction, then you're fine to just go on the way you're going on. I would add a suggestion here in a minute, but the other big treatment option is getting what's called the release. And this is where the tether, whether that's the frenulum or the lip frenulum, is cut via scissors, or typically now more so lasers, which is my preferred method if you're going to ask me. This is called a frenectomy, and it involves releasing that tension there. So what this typically looks like is this is done by, I would say more often than not, a pediatric dentist, and they have a CO2 laser, and they will take baby, infant, child, whoever back into their room, and they will use the CO2 laser to cut that tether. And then this creates an open wound, and that open wound needs to stay open, because if it heals right away, it's going to heal right back in the position it was before. And what we need it to do is we need to heal in that open form, so that new shape is now there, that tether is now elongated by cutting that tissue. So for 3 to 6 weeks following the release, stretches need to be performed about every 4 to 6 hours to release the wound. And it can be very challenging, especially if you have older kids. I think that's a lot harder. When you have a younger child, it's easier to do the stretches. They cry, they scream, it hurts for a second, but then especially if you can feed them right afterwards, soothe them right afterwards, it really does. They really calm down really quickly. If you don't do these stretches, again, the tongue will heal back in its original position. And not only that, it will heal with the addition of scar tissue, which can just make that tension even worse, can restrict movement even worse. So that is definitely needed. Another thing to keep in mind, and this is a huge, huge point for me, along with the frenulum being tight, we have the body being tight as well. In most cases, I would say, if the body is still tight when that tongue is released, it will pull everything back in as it was. So I have some images of this I'll put up right now on my website, but we talked about, deep set chin, tongue, the chin tucked under, all of that is tight and tense. You release the tongue, you don't release the body, it's going to come right back to the way it was. And this is where we see a lot of people needing what are called revisions. And this is where the tongue has to be cut again or again. And I have seen people go through 2 or 3 releases. And I think this is a big reason why, because we need to have the body prepared for the release. Or we see people go through a release and not see any improvement because they just snipped it, as a lot of people will say, without treating the entire body. And so how do we get the body loose? How do we relieve this tension? Sometimes seeing a chiropractor, seeing a craniosacral therapist, myofascial therapist, physical therapist, or occupational therapist, they can help give you exercises. They can help perform massages and things like that to help reduce the tension in the body. But at home, there are a lot of things you can do. And this is that caveat I was going to add to, if you're not going to do anything, if you're not going to get a release, if you're not going to do anything like that, still do these things. And if you have a baby at home who has any type of tension, still do these things. Tell me time. Anything that gets your baby's body into extension. So when we see that tension, the baby's body is contracted, meaning they're in a C shape. So think about like your knees to your chin, how babies are in that little ball, the position they're in a car seat, the position they're in a baby container, like a swing. That is a contracted position. We want to get them into the opposite, where they're extended. So they're Their knees are away from their chest. They're think about that tummy time position. They're on their tummy. Their chin is up. We're lengthening the space between the chin and the chest. So tummy time, a guppy stretch, which is where you hang them off of your knees and then their head kind of falls back and it stretches that out. Baby bow, which is when they're across your lap, and it's kind of hard to explain without seeing, but their head is off of one side of your leg and then their feet are on the other side and you're encouraging them to open up that way. Tongue mobility work, so using different teether toys to help them move their tongue around in their mouth and get that loose. And then working on that oral posture, so encourage pushing their chin up, encouraging that tongue to stay on the roof of the mouth, and then pulling the chin down and doing that over and over so they can increase the suction and the strength of their tongue to stay up there as you pull down. This is a really good thing to do while they're sleeping or while they're sleepy. So all of those things I think are super important just for any baby in general, but especially for tongue-tied babies, doing those things prior to the release and then after the release are like non-negotiables. We did 90 minutes of tummy time a day per our provider's suggestion. That was a lot, but I think it really made a difference. I had a whole checklist I did every day, which, I mean, they could just looking at that now, I'm like, you know what? Yeah, no wonder you felt the way you did so much of the time because you were feeding every hour, putting down for naps all the time, doing this whole checklist, and it is a lot. So like, just know that I understand how overwhelming this can sound when I'm saying this. Like, that you're already dealing with all of this and now you have to add all this to your to-do list. I get it. You don't have to do all of these things all of the time, but doing a couple of these things throughout your day is going to be really helpful. Other things you can do to help keep the baby in extension and not undo the progress that you're making is to reduce the time in car seats or anything that keeps them in a C position. So for me, anytime I would go somewhere with Teddy, I would immediately put him into a baby carrier when we got there instead of keeping him in his car seat and carrying him around that way. We switched to a convertible car seat very early on, I think about 3 months old, because I didn't want to keep him in the baby in the car seat. I didn't carry him around in the car seat. It was just something we didn't do because I didn't want him in that position. Eliminate time in bouncers, swings, and anything that again keeps the baby in that C to roll over really well. So about 3 months, we laid him on his side or on his tummy to sleep all the time. He was out of his swaddle at 8 weeks, and that was just what worked for us. And we had a Newton mattress, we had the owlet, we had everything that we possibly could to make it as safe as possible. But that is what we did, and it really did help, especially for nap times, for him to be in that extended position versus being on his back, tongue in the same position again. And then last thing, and this is one that I will die on my hill for, but eliminate any sitting tools like bumbo seats, especially if they don't have the core development to hold themselves up unassisted, because again, they don't have that core strength. They're going to fall forward. They're going to be in that C position. And not only that, you're messing with their hips, you're messing with their core. I'm seeing a lot of issues with crawling, sitting, walking, all of those things because baby spends too much time in a baby seat. So those are things you can do outside of that. Just eliminating those things can help to reduce the tension in itself. And that's a really heavy episode. I just want to kind of end on saying that I know how overwhelming this can all be, but just know that it's not an isolated thing. It's not just about the tongue, it's about the body, and it's about all of the things that it can impact later on. It's not just about infant feeding, it's about speech, it's about oral function, it's about sleep, it's about pain and comfort later on in your life. And so I think it's really important to recognize the symptoms, to recognize the different types, to find the appropriate providers And what I would encourage you to do when you are looking into providers like pediatric dentists, speech language pathologists, lactation consultants, all of those things, do they use words like anterior posterior tongue tie? Do they use words like body tension? Do they use words like pre-release care or pre-release, post-release therapies? Are they looking at this in totality, or are they looking at this as just a snip? Red flags for providers are things like same-day procedure. If they're going to allow you to come in, diagnose the tie, and cut the tie in one day, run the other way, because you need to be prepared for what that's going to look like. You need to have baby prepared to go undergo that procedure, and it's not appropriate to do it that same day. If they use terms like snippet, we can just snip it. I would, again, run the other way. Or if there's someone who is not qualified to diagnose the tongue tie and they are confidently saying, I diagnosed, go get this cut today, I would, again, not stick with that provider. So those are my takeaways. What questions do you have?
I just keep having this thought, and I think it's kind of silly, but as a teenager, I tried to learn how to do the splits. And so much of what you're saying is like, we have to look at this challenge, we have to address it, and then we have to do the work to support this child every single day. And if you do your checklist, if you do all of the things, you can get this figured out. And so I think that's really awesome and really beautiful. And my question for you is, and I think maybe you've mentioned this a little bit on other episodes, how did you know that Teddy was doing better? Like you did all of the work, you did the actual release. How did you know something had shifted for him?
So I guess, so our biggest things were spitting up. He would spit up every single feeding, a ton. I thought it was normal because everyone was telling me it was normal, until I have now spent time with more babies. And I'm like, oh, you don't need 75 burp. Like, the amount of burp rags I have in my house is unreal, you guys. It's like, I probably have close to 200 burp rags because it was all the time. And so he's spitting up, tension in the mouth, poor sleep, and then not being able to latch on bottle or breast. And what we started to see improvements was change in his disposition, a decrease in his reflux, and improvement in his feeding on the bottle. He still struggled on the breast, just because we spent so much time off of it, and we never really made it fully back. I would do night feedings, and that was it. That started to improve just with the body work alone. When I knew we needed the release was when I stopped seeing improvements. When the spitting up was still happening, it was better, but it was still happening a lot, and a lot more than it should. He was still tense after all of the stuff we were doing. He still had that tension. Still difficulty latching from time to time on the bottle, which was something that was really concerning to me. And then just like learning more and more of what I knew about the long-term ramifications, I was like, I think this is definitely something that is not enough for us. So after the release, what I saw, which we'll talk about in the next podcast as well, but was kind of, it's, while on a completely different level, it reminds me a lot of your experience, Emmy, in having Twyla and like stepping into your power and just knowing you knew what you were doing all along. It was a really life-changing experience for me to see over the course of like a week, him stick out his tongue for the first time, him smile more and more because he could, him feeding at nighttime better with me, him feeding, actually he fed right on the breast right after his release, which was huge. Reduced spit up so much. He was like the tension in his body melted away over the course of that week. And it was the first time I had that baby who flops on you. And I was like, oh, the heart, actually having like that heart to heart. He was always up here. It was always tight. And so having him like on me, chest to chest for the first time, I knew I had made the right decision. And then down the road, when he was a little over 1, he said, I hear that in my ears. And the way he said his R's like that, it was like, you never would have been able to do that that was such an advanced sound and such wonderful motor function for him to say, I hear that in my ears. And I like that will stick with me for the rest of my life. So I keep seeing things now even of improvements. And so I would just look, if you are somebody who is going through this, look at your symptoms and try to pinpoint the ones that are the greatest and see and watch those improvements over time and start. I would truly start with the body work, even if it's just like a couple of weeks. Give yourself 2 or 3 weeks to just do body work, just do tummy time, do those stretches and see where you're at. And then go see your provider again, see where you're at, see if they're ready. And a good provider will not rush you, because while I understand, trust me, I understand. I asked, we did 14 weeks of free work leading up to the release, which was maybe more than he needed. I honestly don't know. But every single time I was like, is he ready? Is he ready? Is he ready? Is he ready? No, like it was just, you just want it to be over. But yeah, it's necessary, and it's that pain with a purpose.
That's super inspirational. Really amazing story of triumph for you and for him, and probably your whole family.
I think it was, and I think the reason I feel like I would need to talk about it all the time is because I see moms kind of feel like they're crazy going through this and feeling weak for not being able to handle it. And I fully understand that there are people going through much worse things than this, but it really does and really can impact every aspect of your life and their life. And that's hard. And I want to, definitely hold space for that. So if you have any questions about tongue ties, lip ties, cheek ties, anything we talked about today, you can start off by going to that website I mentioned, freedupmamas.com, which will be linked down below. You can always reach out to me. Like I said, I'm happy to help you find providers in your area, connect you with my friend Chelsea, who can help you to get the diagnosis that you need, and even do virtual therapy, which can be phenomenal and so wonderful to help you actually learn how to do that therapy on your child, so that you have the power to do that whenever you need to, and you don't need to pay someone to go back and do that every single time, which I think is wonderful. And then for everything else, our contact information is down below. If you want to be on the podcast, definitely send us an email. We would love to have you on to tell your stories of motherhood and birth. And if you're listening on Apple Podcasts or on Spotify, give us a 5-star rating, write us a review. That means the world. If you're listening on I was going to say SpewTube. If you're listening on YouTube, make sure that you subscribe, give us a like, drop us a comment. All of those things, again, really help us out. And anything else, Emmy?
I'm excited for the new year. I think we're going to have some guest speakers, and I think it's going to be really fun to have some new voices on the podcast to share some more fun stories, so information. So
yeah,
look forward to that, everybody.
Yeah, we have a lot of guests lined up, which is going to be really cool. A lot of variety of them. So it is going to be awesome. Yep. All right. Thanks again for being here, everybody. We will see you next week. Bye.